And when it comes to hormones, a person's life can feel like a roller coaster. From the hormone fluctuations of menopause that can be downright annoying to the hormone fluctuations of diabetes that can be downright dangerous. And fortunately, we have a new doctor in our area that specializes in just such problems. I got a chance to meet him. Take a look.
So basically, I just finished my fellowship training at Mayo Clinic in Jacksonville, Florida, and there was a 2-year program in adult endocrinology. So after my medical school training, my residency training, which was all in Michigan, went to Mayo Clinic and specialized in adult endocrinology. And then about a couple months ago, moved over here to start practicing with Medical Associates.
So explain to folks a little bit about what you do.
So my specialty is endocrinology, which is basically the science of hormones in the body and the study of different hormones in the body. So in our body we have many glands and they produce different hormones. And whenever there's hormone excess, hormone deficiencies, people can have various symptoms. And the typical conditions that we tend to treat are diabetes, thyroid conditions, adrenal conditions, issues with bone, say osteoporosis, and sometimes issues with the pituitary gland as well. And we also help the primary care physicians with difficult to manage blood pressure cases as well as difficult to manage cholesterol cases.
Now, you mentioned diabetes, and that's such an issue that everyone's dealing with these days. What are some signs and symptoms that maybe somebody needs to come and see you?
So some of the typical signs and symptoms in adults for diabetes would be increased urination, increased thirst, just feeling down, fatigued, maybe an increased appetite. Sometimes there can actually be weight loss, which is associated with the diabetes symptoms. And in some of the younger children, the symptoms can be a little bit atypical. So they can have the other symptoms that I just mentioned, but you can sometimes see a change in their habits, sometimes a change in their attention in school, decline in school performance, or concentration behavioral issues.
Now, can they come and see you directly, or do they need to see their primary first?
So basically, they would need to see their primary care physician first, and after they discuss with their primary care physician and their primary care doc does, some routine testing, then they would have a conversation about being referred to an adult endocrinologist, and that's where I can kind of pick up, where they left off.
And the really neat thing about you, too, is that you kind of help folks deal with it, and you help them lead their lives and what they should be doing and pay closer attention to it.
That's correct. That's correct. Diabetes is a chronic medical condition, and it needs to be followed very closely through, say, a primary care physician or even a specialist such as an endocrinologist. And, what I'd like to stress is that diabetes is also a very individual condition. What may work for some people may not work for another. And close follow-up with checking blood sugars, sending them into your doctors, and fine-tuning certain medicines, whether they be oral medicines with pills or, say, insulin therapy, fine-tuning those based on a patient's lifestyle and how they react to those medicines is very important. So it's a very long-term process that needs to have a close rapport between the patient and their physician.
It must be exciting for you to know that you're doing something that's going to improve the quality of someone's life overall.
Yes, definitely, definitely. Diabetes is a condition, as well as some of the other endocrine conditions, where because they're chronic, they need to have close management.
Right.
And diabetes, for instance, if we can really get a strong hold on managing diabetes and having individuals with better blood sugar control, we can really help prevent other conditions like heart attack, stroke, and peripheral vascular disease, which are at higher risks for individuals that have diabetes.
Would you also treat women with menopause?
We would also see women with menopause. A lot of times they see, say, their primary care doctor or their gynecologist first. However, if they've been on some treatment, they're still having symptoms that are having, causing them to have some trouble with doing daily activities and things like that, we see them, we talk to them a little bit further and see maybe there's something other than menopause that could be causing the symptoms they're having. And we would do the appropriate workup with, say, hormone studies and kind of go over what treatment they've had before and see if there's something else that could make them feel better.
And if you'd like to know more about the endocrinology services, you can give them a call at 434-947-5220 or go to centralvamd.com.